Coming up on Mountain News this morning, we bring you the latest on COVID-19's arrival to eastern Kentucky as more cases were announced yesterday. And Senator Rand Paul is in quarantine after testing positive for COVID-19 and is facing backlash for his decision to not do so earlier. And we show you how some doctors' offices are changing up their services to care for as many people as possible while limiting the risk of infection.
Dedicated to eastern and southern Kentucky, this is WYMT Mountain News This Morning.
Good morning. Today is Tuesday, March 24th, and I'm Lacey Roberts. Thank you for joining us on Mountain News this morning. It actually feels pretty good outside, maybe a little chilly, and hopefully today can bring us just a peak of sunshine. Let's check in with Brandon Robinson for a look at our forecast this morning. Brandon, is that right? Just a
Fingers crossed. Yes, I do believe we'll see a peak early this morning because the clouds have kind of backed off a little bit in the overnight. We talked about that could happen, partial clearing. Let's take a look at the satellite and radar, and you'll see there clouds kind of ebbing and flowing this morning, but they'll start to increase relatively quickly, so we may squeeze out just a little peak early this morning. We'll see how that goes. Fog dense this morning, especially from Richmond down toward Monticello along Lake Cumberland over toward the Cumberland Valley, Harlan and Middlesboro, some limited visibility, so be careful of that this morning. Some of the ridges seeing some of that dense fog too. We'll show you some of the cameras here in just a little bit. Big swing. So you see areas that might have got out from under the clouds for a little bit, like Lexington, Danville, Irvin, and Somerset in the 30s this morning. Most of the area in the 40s, but down south, they got a little bit optimistic there, a little bit overachieving there. 50 in Jonesville and Jacksboro. So 30s to 50s this morning. Out the door forecast, I kind of split it right there in the middle in the 40s, and we'll see those temperatures climb right around 60 later today, but it's dry to start the day. But of course, we can't get past one day without those rain chances, at least not yet. We'll talk about the extended forecast in a little bit. Lacey.
Thank you, Brandon. Governor Andy Beshear says Kentucky now has 124 confirmed COVID-19 cases. He announced one new case here in eastern Kentucky Monday. That case is out of Breathitt County, bringing their total up to 2. We also learned about a 4th person who died, an 82-year-old woman from Lexington with underlying health issues. The governor also announced the Team Kentucky Fund. Those donations will help people impacted by COVID-19 and are tax deductible. And there is now a new hotline to report groups of businesses not complying with the governor's orders to close or change the way they operate. And that number is 1-833-KY-SAFER or 1-833-597-2337. Again, that is 1-833-597-2337. And Senator Rand Paul is in quarantine after testing positive for COVID-19. Senator Paul says he does not have any symptoms. He says he is not aware of any direct contact he had with any infected person. So far, Paul is the only senator to test positive. Yesterday, he issued a statement calling for more testing. He said the broader the testing and the less finger pointing we have, the better. America is strong and we are resilient people, but we're stronger when we stand together. And he is defending his decision not to self-quarantine after learning he was exposed to the coronavirus. Paul is a physician as well as a politician, so several senators say he should have known better. Paul says, according to guidelines, he did not meet the threshold for getting tested for coronavirus. He says he felt fine and thought the test was just a precaution. He says that's why he did not think he needed to self-quarantine, but even members of his own party say Paul made the wrong decision. Some GOP senators tell CNN that Paul went to the Senate gym Sunday morning. And as cases of COVID-19 spread across the Commonwealth, health officials are warning that there will be more. Officials continue to stress the importance of social distancing as well as self-isolating if you have symptoms or come in contact with someone who may have the coronavirus. Health officials say this is not just about slowing the spread, but about not overwhelming the healthcare system.
The next 2 weeks are extremely critical, and if I can emphasize anything to your viewing audience is that we really need to heed these recommendations, because if we can slow the spread now, we're going to be able to manage this, and it's going to be at a level that is controllable for our healthcare resources, our partners at the hospitals and our clinics and so on. If we do not, then the demand for services is going to exceed our ability to provide them.
Walker says it is important to continue washing your hands and to not participate in those large gatherings. Appalachian Regional Healthcare is setting up screening tents outside of its facilities throughout our region, and those tents opened yesterday. Health experts with ARH say the tents are a way to create a buffer system to keep patients and hospital staff safe. The Prestonsburg location has not yet tested anyone for COVID-19, but staff there say they are prepared to do so. And ARH is not alone in taking these steps. Some local doctors' offices are giving patients an option to not even step foot into their office by opening drive-through clinics. Now, early last week, Frontier Medical put up tents to treat patients, and in the tents, nurses will give patients a full exam, examining their chest, ears, throat, and their vitals. And also, if needed, a doctor will examine them as well. If a patient has the symptoms for COVID-19, they will perform the coronavirus test. They say that they have many tests available.
It's a nasopharyngeal swab, so it's a little further in than just the nose. To get a good sample, it will need to go to behind your nose. Is unpleasant, obviously, but it's in some cases it's needed.
Patients still have the option to go inside the office as well. They have the office section off to healthy patients and for those who do need isolation. UK healthcare officials say they have tested more than 900 people, and only 17 of those people were confirmed to have COVID-19. And of those, 4 people had to be hospitalized. UK healthcare says 2 of those people are still being treated, but are in fair condition. UK hospital says they are also relying on telehealth services to cut down on people having to be at the hospital.
Able to assess if they're in respiratory distress, how ill they look. We ask them to take, if they have thermometers and blood pressure machines at home, to check their vitals. We even have them get close up and look at their throat if we need to. So it's a video telemedicine visit.
A Harrison County person who was the first patient in Kentucky has since recovered. UK says most people are likely to survive, but that they can take 2 weeks to completely recover. And the Kentucky Blood Center is expanding its center hours effective immediately and is urging donors to schedule appointments. This is all in an effort to maintain an adequate blood supply for the more than 70 Kentucky hospitals while keeping donor safety at the forefront of those operations. Kentucky Blood Center is opening all 6 of its donor centers from 9 a.m. until 7 p.m. Monday through Friday, and 8 a.m. until 2 p.m. Saturdays until at least April 11th to better accommodate those wishing to donate blood. Well, thank you for getting your day started with us here on Mountain News this morning. Coming up, we show you how one community outreach program in Pike County is making sure that they can still help the community while keeping people safe.
The warming trend begins today and carries us well into the weekend. I'll tell you how warm we can get the next few days in 3 minutes.